Today, let's learn about the ascending tract or somatosensory pathway. This carries the information from peripheral nerves to the cerebral cortex. In this, there are two types of tracts. One is the conscious tract that goes to the cerebral cortex, and the other is unconscious tract that goes to the cerebellum. In conscious tract, there are two: dorsal column medial lemniscal pathway and anterolateral pathway. In dorsal column medial lemniscal pathway, the informations of fine touch, tactile sensations, vibrations, and proprioceptions are carried. In this, there are first order neurons, second order neurons, and third order neurons. In first order neuron starts from the peripheral nerves to the medulla oblongata. The information from the upper limb is carried from T6 level and above from the fasciculus cuneatus to the nucleus cuneatus, and information from the lower limb is carried from the fasciculus gracilis to nucleus gracilis in the medulla oblongata. Here, the first order neuron finishes and the second order neuron starts. Start at the level of nucleus cuneatus and nucleus gracilis and at the thalamus. Now, in the medulla oblongata, there is decussation to contralateral medial lemniscus. Now, the second order neuron synapse at the level of thalamus, and from here, the information is carried through the internal capsule to the sensory cortex. The other is anterolateral system. In anterolateral system, there are two tracts. One is the anterior and the other is lateral. Now let's learn about their pathway and where they decussate. There are first order neurons, second order neurons, and third order neurons. Information start from the periphery, enter the spinal cord, and ascend 2 to 3 vertebral columns and synapse at the level of substantia gelatinosa in the spinal cord. Now, in the substantia gelatinosa, second order neuron starts and there is decussation at the level of spinal cord. They travel to the opposite side and ascend towards the thalamus. After decussation, two tracts are formed. One is anterior and the other is lateral. Anterior carries the information of crude touch and pressure, while lateral carries the information of pain and temperature. Now they synapse at the level of thalamus, and at the thalamus, third order neurons start, which goes to the primary sensory cortex in the brain. In thalamus, there are ventro-posterior lateral nucleus for both the anterolateral system and for the dorsal column medial lemniscal system. And information is carried through the internal capsule to the sensory cortex. Now, there is a difference here that in the decussation, in dorsal column medial lemniscal pathway, we have seen that there is decussation at the level of medulla oblongata. After the level of medulla oblongata, there is decussation in dorsal column medial lemniscal pathway, while in anterolateral pathway, there is decussation at the level of spinal cord. So, what makes difference here is that if there is lesion at the level of spinal cord, then the information of dorsal column medial lemniscal pathway will be gone of that side, same side. While if anterolateral system is involved, if there is a lesion of anterolateral pathway, then information has decussate. There is decussation at the level of spinal cord, so there will be the loss that will be contralateral. So now we will discuss about the injuries of dorsal column medial lemniscal pathway. So there is loss of that sensation which is carried through that pathway. So if dorsal column medial lemniscal pathway is injured, then there is loss of fine touch, tactile sensations, vibrations, and proprioceptions. Now, if the lesion is at the level of spinal cord, as we know that there is decussation at the level of medulla oblongata, so the information that is the loss of information in the ipsilateral side, and In if there is dorsal column medial lemniscal pathway, there is lesion of in vitamin B12 deficiency, and in syphilis complication there is a disease called tabes dorsalis, in which there is the lesion that is harming the dorsal column medial lemniscal pathway. Now there is another pathway we have discussed, that is anterolateral system, which carries the information for pain, temperature. If there is lesion at the level of spinal cord, then the sensations are lost at the contralateral side. Then there is a syndrome called Brown-Sequard syndrome that could be due to injury, any trauma. If and in here there is a spinal cord and half of the spinal cord sensations are lost. No, if half of the spinal cord is involved, then there is dorsal column medial lemniscal pathways involvement, and if it is involved, as we have discussed earlier, that if dorsal column medial lemniscal pathway is involved, then there is the loss of sensation of ipsilateral side, and if anterolateral tract is involved, then there is loss of sensation of the contralateral side. Now, in Brown-Sequard syndrome, there is involvement of motor descending tract, which can cause hemiparesis. Now, we have done the conscious tract. Now, let's go to the unconscious tract. In unconscious tract, it carries information of proprioception. Now, what is the importance of unconscious tract is that it helps the brain to coordinate and refine the motor movements. Now, there is the information that is carried from the muscles to the level of cerebellum. There are four individual pathways here. One is posterior spinocerebellar tract, other is anterior spinocerebellar tract, cuneo-cerebellar tract, and rostral spinocerebellar tract. So, here there is no decussation in the three, while in anterior spinocerebellar tract, decussates two times. Means one times it decussate and come to this side, and then there is another decussation and the information is carried to the ipsilateral side of cerebellum. Now, if there is lesion in the unconscious tract, which is spinocerebellar tract, now in the lesions of unconscious tract, that is spinocerebellar tract, there is ipsilateral loss of muscle coordination. Now, it is very unlikely that the spinocerebellar tract is damaged in isolation. So, there may be the damage to descending motor tract with it. If descending motor tract is involved, descending motor tract involvement causes paralysis and muscle weakness, and so the effects that are due to spinocerebellar tract are masked. So, up till now we have discussed the conscious tract that include dorsal column medial lemniscal pathway and anterolateral pathway, and a unconscious tract that is spinocerebellar tract. Thank you.